in continuation of our understanding of the basic structure function of kidney, which is the filter in our body, today we are going to start discussion on infections of the kidney, which is called pyelonephritis. Pyelonephritis is a condition when infections sometimes ascend from the lower urinary tract and the bacteria reaches. It can be classified as acute pyelonephritis or chronic pyelonephritis. Acute pyelonephritis, sometimes kidney can swell up and it can damage the kidney. Sometimes acute pyelonephritis can be also very serious and life-threatening. And if repeated such infection takes place, it can give rise to chronic pyelonephritis with scarring of the kidneys. The chronic pyelonephritis is comparatively a rarer type, and it usually happens in children when there is a urinary tract obstruction, which means there is retention of the infected urine in that area. Now we are going to talk about symptoms, which means what are the complaints with which the patient is going to come to us. Fever. Acute pyelonephritis is always associated with fever. Sometimes fever can be so high, going up to 100 to 102 degrees. It can be associated with chills and rigors. There is pain in the abdomen. Pain can be at the back or from the sides, can reach up to the groin. Urgency. Sometimes there can be severe urge to pass urine, and it can be also associated with pain and also sometimes burning sensation while passing urine. The urine which is passed sometimes can be cloudy or mucky, and fishy smell can be associated with it. In the urine there can be presence of pus or even blood. The other symptoms that can be associated with acute pyelonephritis could be a generalized malaise and weakness or fatigue, and sometimes nausea, vomiting, and sometimes in elderly people will be with presentation with confusion. They may not have very typical features, but just a disorientation and confusion. Causes, or how does this thing take place? Usually the infection enters from the urethra. Now female urethra is of a shorter length, and that's why women are at a higher risk of developing lower urinary tract infection. The common organism is Escherichia coli, which is known as E. coli. The UTI, which is urinary tract infection, actually spreads through the urethra into the bladder, and if this urine has a reflux, which is called vesico-ureteric reflux, this infection can spread from the bladder into the kidney, giving rise to acute pyelonephritis. Are there any risk factors? Who are the people who are more susceptible to get this acute pyelonephritis? We have already discussed women. They are at a higher risk because of their shorter length of urethra, and the infection tends to travel inside and spread around. Elderly people are at a higher risk. People with prostatic enlargement, men whose urinary system has got a outflow obstruction, the urine tends to stay there, residual infected urine, they are at a higher risk. People who are immunosuppressed, they are at a higher risk of developing this infection, which means diabetic people, people who have got cancer, people who are HIV positive, or if there are patients who are on immunosuppressive drugs for any reasons. So they don't have their body resistant and immunity to fight the entering of the bacteria. There are certain other factors which can influence this also, like catheterization. Catheter is something which is a small rubber tube which is put inside the bladder when people cannot pass urine. So if there is a retention of urine when catheter is passed, or there are certain spinal or nerve injury where the person is not able to pass urine and needing catheterization, they have a higher risk of developing urinary tract infection. People who have had urinary tract procedure like cystoscopy, or people who have had urinary tract surgery. So when the patient comes with these symptoms and signs, how do we establish the diagnosis? We order a couple of tests. The first is going to be the urine test. The urine will have sometimes pus cells, leukocytes, or it will have traces of blood in urine. An ultrasound scan will give a certain clue if there are cysts, whether there is a dilated urinary system, which is hydronephrosis, or if there is any obstruction, whether there are stones, or if prostatic enlargement causing retention. So basically this is to establish whether urinary system is obstructed. Sometimes even after treating for 72 hours with antibiotics and others, if there is no response, we usually like to get a CT scan with or without a dye. Sometimes we also need a radioactive imaging, which is a D.UROL scan. Now this also gives us certain idea about whether there has been scarring of the kidney. Now that we have established the diagnosis, urinary tract infections with or without pyelonephritis, the treatment of choice will be antibiotic. The antibiotics that were normally used are levofloxacin, ciprofloxacin, norfloxacin, but at times we need to do urine for culture and sensitivity. In culture and sensitivity, we can identify the type of bacteria and we can see whether this bacteria is sensitive to that antibiotic, accordingly decide on the antibiotic that we want to give. Sometimes when they don't respond to these antibiotics, rarely that is, it can give rise to certain complications. The infection can spread into the bloodstream, and this is called bacteremia and gives rise to septicemia or sepsis. Sometimes repeated such infections can give rise to complication of scarred kidney. It can give rise to renal failure, and it can also sometimes give rise to infection around the kidney, giving rise to sometimes kidney abscess formations. In cases where just antibiotic do not treat the condition, and we have established by imaging technique that there are certain obstruction, surgery comes in play because obstructive area has to be repaired. There is a condition called PUJ obstruction, pelvic-ureteric junction obstruction. That means where the ureter comes out of the kidney, there is a kink over there and there is a retention of urine. This has to be surgically corrected by re-anastomosis and joining over there. Sometimes if there is a stricture in the passage, if there is a stone in the ureter, or if there is prostatic obstructions, which means these are conditions which is giving rise to obstructive urinary system, they need surgical correction to treat pyelonephritis. The other special condition that needs a mention is pyelonephritis or urinary tract infection in pregnant women. This has to be treated very early and carefully because here the mother and the child both are at risk. Urine has to be cultured and accordingly antibiotic has to be started. Now that we have checked the way to diagnose, treat, what about prevention? Because don't we always say prevention is better than cure? Number one point is drink enough water or fluids so that you are well hydrated and you can have good amount of urine to flush the urinary system. Number two is after having sexual intercourse, one should flush the urinary system by passing urine, micturition after having an intercourse. Number 3 is people who are using tissue paper for after defecation. The one thing that especially in women it is recommended that the wiping should be front to back and not from back to front, so that fecal bacteria and contamination do not enter near the urinary passage. Avoid using certain feminine spray which can irritate the urethra. If you have understood regarding urinary tract infection, UTI or pyelonephritis, please like, share this video with your friends, subscribe to my channel and keep listening, because our next video on kidney we will come up with kidney stones and kidney cancers.